Okay, you're getting code 4 to a construction site for a male who kicked rebar and he is fry negative.
Okay. So the environment is a construction site, so I'm gonna have whoever is in charge halt any heavy equipment operations just to secure the scene. Is it today's date and time?
It is.
Okay, so it's later at night, it's dark and cold, so I'm gonna have my floodlights on so I can see, and I'm gonna wear a jacket because it's a little cold, and then bring a blanket for my patient. Mechanism of injury, he fell and kicked some rebar. Casualties, only one casualty known this far. Allies, just me and my partner, will request additional as needed, and PPE, we're just gonna go in, sorry, was it fry negative?
Yeah.
Fry negative, so we're gonna go in with our standard PPE. Get to the scene, we'll just lower the stretcher down. 3, 1, 2, 3. Okay, so I get to the scene. Am I greeted by anybody? Do I just see the patient?
You just see the patient.
Just see the patient. So I'm looking at his appearance. Is he just sitting in the chair? Does he track me as he sees me? Does he look like he's looking around the room, interacting with the surroundings?
Yeah, he's talking to some coworkers and he looks at you and he's just sitting as found.
Okay, and for his work of breathing, do I see chest rise, chest fall? Do I hear any adventitious sounds, any abnormal sounds?
You don't hear sounds, you do see him breathing.
I do see him breathing. And for circulation, what's his skin condition like? Is he pink, warm, dry?
He is pink, warm, dry. Yeah.
Pink, dry. And do I notice any like major bleeding, anything like that?
Nothing major, no.
Nothing major. Do I see any bleeding a little bit?
Not really.
Not really? Okay. So I'm going to say, hello, my name's Julien. I'm a student paramedic. This is my partner, Carter. What's your name?
My name's Mark.
Mark, it's nice to meet you, Mark. How old are you?
I'm 23.
23. And just a quick question for you. Have you or anyone in your family had new or worsening symptoms of fever, chills, diarrhea, vomiting, shortness of breath, or cough?
No, I have not.
No? And when you hit your ankle, did you fall, hit your head, neck, or back at all?
I didn't, no, I just sat myself down.
You sat yourself down, you don't have any head, neck, or back pain?
No.
No? And like, what seems to be bothering you today?
I just hit my foot on some rebar and then I took it out. I think it might be bleeding a little bit.
Okay. And as I'm approaching, I'm going to ask, do you know where you are?
I do. I'm at the construction site.
At the construction site, and what time is it?
It's approximately 8 p.m., I'd say.
8 p.m., okay. So, you said you kicked rebar. Did it get stuck in your ankle?
It did momentarily, and then I took it out.
Took it out. Do you mind if I take a look?
Yeah.
Okay, so I'm exposing it. Do I notice any blood? What do I see?
You see a little bit of blood. It's nothing too serious.
All right, partner. I'll get you to check the pulse motor sensation. Bandage it up, and then check the pulse motor sensation again. You just prompt me once you check the pulse motor sensation, so I can do that. So, Mark, can you please hand me your wrist, please? I just need to check your pulse.
He gives it to you.
And can you open your mouth for me?
He opens it.
I'm looking in his mouth. Do I see any blood, any broken teeth, any secretions?
Nothing in the airway, no.
Nothing in the airway. And can you just rub your tongue around your mouth for me, please, so I can see if you have any broken teeth?
No.
Tell me if you have any broken teeth.
No broken teeth.
Okay. And do I notice any facial droop, any slurred speech, anything like that?
Nope, you don't.
Okay. And his breathing, what's the approximate rate, rhythm, volume, effort?
He's breathing regularly.
Okay. And
how is the pulse motor sensation?
how's the pulse motor sensation?
It's regular, it's fine.
Okay. And feeling his pulse, what's the approximate rate, rhythm, volume?
Pulse is regular. It's a little quick, but other than that, it's good.
Oh, quick. And the skin condition, what's the approximate temp, moisture, and color?
It's warm, it's pink, and it's dry.
Okay. And Mark, could you tell me if you feel like you're bleeding anywhere else? Did you hit any other part of your body?
No, it was just my ankle there.
No, so you don't feel wet or bleeding anywhere else?
No, I don't.
No? And do you have any medical alert bracelets that we should know about? I don't see any currently, but I'm just wondering if you have anything along those lines.
Nope, I don't have any.
No? Okay. So,
And how's PMS?
PMS is the same.
so last thing, I'm just going to get you to give me a big smile, Mark.
He does.
Do I see any facial droop?
You do not see any facial
Okay,
droop.
and then I'm going to get you to hold both your arms in the air for me. So if you could just pass me your arms.
He gives them to you.
Okay, so I hold them. I'm just going to get you to close your eyes, and I'm going to count to 10, and I need you to hold your hands up for me, all right?
Okay.
1, 10.
And the arms don't drop.
Your arms don't drop. Okay, and then I'm gonna get you to squeeze my hands for me. All right.
Yep, and he squeezes it.
Okay. All right. So Mark's GCS was 15, eyes 4, verbal 5, motor 6. The critical intervention, we had to bandage his ankle up. He had a piece of rebar that penetrated his ankle, so distal to the knee, so it's not a load and go because it's a penetrating injury, distal to the knee, and very minor bleeding. He had, however, taken the piece of rebar out.